can establish a more harmonious, a more measured form of governance. But can power be exercised without that passion that consumes the heart as well?
No audio.
We can, no audio. Okay, very good. Can you hear me now on our online platform?
Yes.
Okay, very good. I appreciate it. Thank you for the feedback. Again, let's get started because we have so many things to actually impart today with everyone, and we hope that this is a very well-meaning learning experience for everyone. Please allow me to read a few disclaimers for this webinar. This was made possible by the cooperative agreement of the CDC RFA IP 21-2106 from the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of the CDC and HHS. I also want to express our thanks to Carmina Bautista, to our president, Janet Rodriguez, to PNAA and to PNAAF for making this learning education available to everyone. I do not have any relevant financial relationships with ineligible companies for those involved with the ability to control the content of this activity. We would like to
PNA from 10 to 2. Virtual
we would like to request some of our online attendees to themselves.
MSN, RNSN, clinical nurse leadership.
If any arise, an announcement will be made at the beginning of the program. Thank you so much. All right, let's get started. How is everybody feeling today? So for our online community, please place on the chat box any emojis or emoticons that you are actually feeling this morning. And I want a thumbs up or a thumbs down for our audience right here, or a yay or a nay. I want to make sure that we are starting correctly this morning. I do have a lot of thumbs up in our live audience right there. And let me check our online community to make sure. Okay, very good. I have thumbs up and a very happy emoji sign as well. Very good. Thank you so much for joining us today. So today we have a very important topic to discuss. Oh, I want to make sure that I do say this first. I do want to properly thank VA Harbor Health Care System and the Manhattan campus for sponsoring our event today. I also want to thank Carmel in the back for helping us greatly with our technology this morning. Thank you so much. So our topic today is very important, primarily because we all have that opportunity to better ourselves in becoming better healthcare practitioners when we do our patient education, right? The COVID pandemic was a game changer for everyone. Before, we used to rely on a lot of our base knowledge in teaching, foundational research, and a lot of information out there to actually discuss and do effective patient education. But the pandemic, there was nothing to really rely on, right? We were just really going through what information was being given to us. And today we're going to discuss how we can effectively allay misinformation in the public as we continually to be effective healthcare providers and healthcare educators to actually better the lives of the communities that we serve. Let's take a poll. This is very important. Let's start with a very important word this morning. What does trust mean to you? I'm going to step away from the camera, and I do want to remind our audience that we are hybrid platform. So we have a live audience and an online audience. So I'm going to step away from the platform for a second, because I'm going to ask some of our audience, and for those on our online community, please type in the chat box, what do you feel trust means to you? Anybody? What does trust mean? What comes to mind when we say the word trust? Yes, Dr. Sayer.
Confidence in the information that you're getting.
Very good. Confidence in the information you're getting, and not just only in the confidence, but also on the person that's delivering it, right? So there is confidence in that person, in that information. How about you, Nora?
Integrity and reliability.
Very good. Integrity and reliability of the person. Integrity of the information we're sharing. Anybody else before we go on to online chat?
There's trust as well.
Very good. So thank you, Bernie, for actually reinforcing everything. And I want to check what our online community is saying about trust. Okay. So nothing in our online community. Do you hear me? I want to make sure that you are also participating. What do you feel trust is? We seem to be having an issue with our PowerPoint. Should I move this? Because this one is not, there we go. Okay, there we are. We're finally caught up. So I asked everyone, our online and our live, what trust means. And trust is very important, primarily because of what had everybody shared, right? It is the integrity, the confidence, and the respect. It means that you have somebody else's back, right? That you are supported by the person that you trust. And the good thing is, in our profession, for the last 22 years, nursing has been ranked as the most trusted profession. This is very important because we need that trust from our public, from our community. And that's what we're going to discuss today, is really how to enhance that trust, restore it if it needs be, reinforce it if it needs be, or build it. Now, there are so many things that we can discuss how we can gain that trust, especially when we do the patient education piece. The very first thing is we need to be able to articulate advocacy. So how do you do that? Anybody? So this lecture now is going to do a lot of reflective exercises for you to be able to participate in these things. Because sometimes we do these things, you know, just out of our just customary things, right? But we are not aware that we actually need to develop some of these skills to actually have better patient outcomes. So I'm going to throw this question again to both our online and our live audience. How can we actually articulate advocacy? Yes, I'm going to have somebody here.
How do you communicate to your patient? Do you demonstrate that knowledge so that your patient knows that you know what you're doing and you are well knowledge about the subject of the disease and caring, showing for caring for the patient itself?
I think Yvonne, thank you so much. I think she brought up a very good point there. I think she brought up a very good point there, and I hope our online audience heard her speak, that it is something to do with establishing a really good communication, right? I see here that you can develop advocacy for being the voice, sharing ideas, clear, efficient communication, very good, which was actually established. So the thing about articulation first is to convey our advocacy. It is best for us to really introduce ourselves as an advocate properly, right? How many of you actually introduce your name to a patient? How many? Raise of hand. Online, do you say, "Hi, I'm Laarni"? Do you follow it after with a thought saying, "I am a nurse"? Very good, because that is important. Remember on the previous slide, we've been trusted by the community for 22 years as someone with integrity. And to be able to establish a good relationship with our communities, with our patients, with our families, sometimes we have to be able to articulate introducing ourselves clearly with much confidence and integrity. "Hi, I'm Laarni, I am a nurse." How do you follow that up with a confirmation of advocacy for them? Would be for you to say your availability, your ability to help them. How many of you actually introduce yourselves to anyone when you're out in the community, out with your patients, saying, "Hi, I'm Laarni, I'm a nurse. I am here for you. I am here to help you. I am here to explain your medications to you. I am here to answer any questions you have about any of your healthcare concerns." Now, I want you to do something, and this is a plain exercise. I want you to introduce yourselves to your seatmate to your right and say the same thing. "Hi," state your name, state that you are a nurse. Just pick a partner and say a statement of advocacy saying, "I am here for you." And for those that are online, I want you to type in the chat your name, your profession, and a statement of advocacy that you are there for your patients. Let me see. Yes, I do agree with a lot of our online feedback about being part of the nursing practice, even more so that we have to be very good at it, right? Because it is part of our nursing practice. Now, I want to ask now our live audience, how did it feel when somebody introduced themselves to you that way? How did it feel? Did you feel like, you know what, I can trust her? I feel comfortable actually telling her what I need. Did you feel that way? Raise your hand. How did you feel, right? How about for our online chat? How did it feel for you writing it on the chat? Like a statement of declaration that you are there to help the public. You feel the trust, right? Right away, you feel it because you know somebody is there for you. Now, there are other situations here or suggestions on how to advocate and build that trust with your community. First is you have to assess their readiness to learn. Now, remember, I mean, most of you probably have been on the receiving end of care, right? You have been patients. I think it's even equally harder when you are nurses, right? Because you know more, right? But sometimes you are not ready to receive some of the truth, and you have to respect that when it comes to your patients. There are certain strategies that we are going to discuss later on to actually help you build advocacy and trust, eventually build trust with your patients. Here are just some of the suggestions. You have to listen with intent to understand. and not to respond. So a lot of us, when we listen, you're preparing mentally what to answer for that particular question and not really listen to the concerns of the patient. So we need to change that perspective. Just listen, pause and listen, and place yourselves in the situation of your patient. Also, to promote advocacy, we also have to provide them reliable sources. I will have a discussion later on about reliable resources. We also have to make sure that these resources are credible. And of course, we have to acknowledge and assess the readiness of our audience to learn. Okay. The next one is really making the connection. After you've declared that you are there to help them, it is very important for us to make the connection. The failure of great speakers, or should I say of a lot of speakers, not the great ones actually, is because they failed to make the connection with their audience. Your title alone, your credentials, your position in the community or in the government doesn't make you an effective communicator if you fail to make that connection with your audience. You have to know, you hear these tips, like you have to know when you talk to your audience, you have to be relatable. They have to understand the terms that you are saying. It is not too much for them to comprehend or way above their educational level. Those are some of the things that you have to consider. But sometimes we fail to know our audience. I'll give you an example. A lot of us do these speaking engagements, right? And I usually ask, what type of audience am I speaking with? Because I want to be able to provide them the topic or the information that they really need. Most of the speakers, they prepare their content way ahead based on the theme or what they wanted to say, with no consideration. I think I've just lost my mic. With no consideration for their audience. While we're taking care of our sound, I hope you can still hear me. All right, great. Thank you so much, Audrey. So this is why it's very important. Now, in the virtual world, it's actually hard for us to be able to read our audience nowadays, right? That's why we have to engage them with technology. You can use polling, emoticons, the chat box. You can have them unmute themselves and interact with you. You can do also pulse checks. You can also verify where they're at in following your content delivery by asking them how they're feeling. Right? So that is very important. Now let's discuss a few things. Here are some strategies to actually build effective advocacy and making that connection with your audience. First is motivational interviewing. Who has heard about motivational interviewing? Hello? Okay. Anyone? Have you had the experience, even on our online audience, have you had any experience with motivational interviewing? And where have you experienced motivational interviewing? Most of us actually probably heard about this when we're being interviewed for a job, right? Motivational interviewing is now used mainly in patient education. I think we're having issues with the battery. It keeps dying. Going back to motivational interviewing, it has been a successful strategy now in patient education and community outreach, primarily because it is more collaborative and goal-oriented. You are able to ask open-ended questions to actually assess your learner where they are at in terms of what they know, what they think, and how they feel. This has been very, very effective during the pandemic, as because we are not able to really gauge what they know about the disease, about treatment, about what they're going through in life, or if they know any information about the vaccine. No, it's dying. I think our mic is dying, so hopefully everybody can hear me. If there's any issues on Zoom, just please type it on our chat box. I will appreciate your feedback. Yes, they can hear me. Oh, there's a hands up. Okay. Aubrey, I will need your help in unmuting somebody. Yes. You have to forgive me. I can't see who. Okay, Maria, please go ahead, and then Carmina will follow. Maria, you're unmuted, or you can go ahead and unmute yourself to ask the question or give us your insight. Maria, please unmute yourself, Maria, so you can participate. Maria, if you are speaking, I just want to give you a heads up, we can't hear you.
Are you talking about Marie Angeles?
Yes, somebody raised their hand, yes.
I did not raise my hand.
Oh, is there somebody else? How about Carmina?
That was by accident, but I'll say something anyway. I use motivational interviewing when I'm meeting with my patient to figure out what they need, how it can help, and what are their motivations for the visit.
Thank you, Carmina. That was really very helpful. And I'm glad that you're using motivational interviewing. Can you also expand on your answer and say to us, how does it feel for you using that motivational interviewing? What was the response of your patient, and what is the outcome of that interaction?
I think the interaction, what it does is kind of clarify what they want to accomplish for the visit, and how it gives me an insight of what my patients, how can I effectively help the patient to address issues that they're bringing to the table for that visit or for the whole relationship.
That's great. That's really what I'm going for, is the type of experience that we had. Thank you, Carmina, for sharing that experience. The goal of motivational interviewing is really to engage your patient, to make them part of that learning experience, for them to actually decipher and make the decision on their own, right? So that's why it's collaborative, it's goal-oriented, it's actually more productive and more fruitful because there's self-realization involved. Thank you so much. Now, I have an example here of motivational interviewing. I want you guys all to read this because I want to actually explore how you feel about the example of a traditional approach and the example of the motivational interviewing. Online, I'd like you to tell me your feedback about the traditional approach. Tell me how it made you feel reading that example, and tell me how it made you feel reading the motivational interviewing. And for our live audience, I want you to reflect on this, and I also want you to explore the certain themes that are coming up with a traditional approach, whether they're good or bad, and the themes that are coming up with a motivational interviewing, whether they're good or bad. What do you think are the advantages and the disadvantages? Please go ahead for our online community. If you're ready, just to start typing in your answers. I'd be happy to share that with our live audience. And for those in our live audience, how do you feel about the two? Anyone? Raise of hand. What do you feel is the difference between the traditional approach and the motivational interviewing? What are some of the feelings? Yes, Susan, go ahead.
Traditional is like really giving, not giving the option. So it's like what I tell you is what we should do. So
Yes.
so that's why most of the peers develop this, like I can't make a decision now, but I have to listen to my doctor. The doctor said so, then I have to say the right this minute. I can never take the hospital for a second opinion. But the other one, for motivation, not dictating the treatment. More, I mean, you're giving options.
Yes.
So that the patient or the advocate or whoever is with the patient can think and say, okay, I have the options, but I don't have to make a decision at this moment.
Okay, thank you so much, Susan. And I hope our online audience heard that. She was saying how the traditional was so direct. We're not giving people option. Here it is. This is how it's going to be. While with the motivational, you are actually engaging the patient, right? Yes, Dr. Barroso.
Well, it's basically in the traditional, you're not, yes, that's what you said, you're not engaging the patient in the discussion, but in the motivational, you're enhancing the patient to get involved into the discussion of.
Yes, very good. There is engagement, there is interaction, there is choice, right? You're throwing it back to them so they can make the proper decision. And of course, for you as a health educator, you are also being reflective about what they know, how you can better help them than just giving them information. How about on our online audience? How do you feel about the difference between the traditional approach and the motivational interviewing? Please go ahead and participate by writing in the chat. You can see very clearly that in the traditional approach, right, there is a discord, right? Like there is a, here's the information, whether you need it or not, this is the information I am providing you. But in the motivational interviewing, one simple open-ended question actually helps you explore how that patient needs to be helped, what information you should be providing them. And this is why motivational interviewing is very, very effective. A lot of us usually shy away from motivational interviewing primarily because we think it's a lot of work, right? Or sometimes we don't really know how to handle when people start exploring what they know, how they know it, and other information. But you can see that there is no difference between the motivational and the traditional approach. In fact, if you ask the right question on the motivational interviewing, it can actually open up a lot of information that can save you even better time and more quality time in doing your patient education. Yes, Nora.
In the traditional approach, you feel like it's more authoritative.
Yes.
Like limited or no options. While in the
Yes.
motivational interview, you're able to draw out challenges, barriers for the mom or the resident, the employee or the resident or the patient. So you'll be able to like address all the things that needs to be addressed and be able to give more meaningful and comprehensive resolution.
Very good. You know, Nora, I'm just going to summarize, and I hope our online audience have actually heard what Nora said, because that was really good, you know. And I think it is also strengthened by some of the opinions that we have online, and I want to read it as well. That there is power imbalance, like, you know, Nora was saying, it's more authoritative, right? You're just dishing the information. You're not giving them any choice. Power imbalance in traditional approach, and there is, the patient is passive, right? They're just waiting for things to happen for them. And the HCP is, like Nora is saying, online, our online audience also agrees that the HCP is primarily the authority. Now, traditional is not reflectional, yes, for both the educator and the receiver of the information. It is not reflectional and giving information, gives the opportunity for them to speak information and are more from the patients. It's part of your patient assessment, right? It actually saves you time. If you do motivational, we call it MI, motivational interviewing, it actually saves you time in doing your patient assessments. Very great, great insights. Let's go now to the next part. And here are some of key motivational interviewing skills that you are probably doing. You probably need to enhance, you probably need to develop, or you probably need to practice more. What is the avoid the writing reflex? Most of us are actually very guilty of this. Online audience, what is the writing reflex? And this is so true, not just for nurses, for everyone, right? The writing reflex is our ability to correct something right away. You hear what they're saying to you. Oh, I did this. I put Vicks in my forehead when I have a cold. And your immediate reaction is to correct that statement right away. You have to say where, like you shouldn't put Vicks because the Vicks is not really evidence-based to cure your COVID at this point, right? That is the writing reflex. And everybody has that, right? Whether you're a mom, you're a nurse, you're a friend, your ability to correct right away is like immediate. When we're doing motivational interviewing, we want the health educator to listen. We want you to pause and listen first. You will not be effective in correcting behavior, practices, or imparting knowledge that will probably save their lives without listening. So that's why we kind of have to minimize the writing reflex. The second one is effective use of reflection for both the health educator and the health educator allowing the patient to reflect on where they are at. Yes? Oh, there we go. So these are the key motivational interviewing skills. Thank you for saying that. The next one is appropriate use of open-ended, which is MI, right? Motivational interviewing. We ask these questions to really explore, to really engage, and really know more about what our patient's status is, what they know, and what they've done. Next is affirmations. What are affirmations? I think Nora can answer this. Nora is very good with affirmations. Online chat audience, what are affirmations? Affirmations is the ability to actually recognize a positive attribute. You're doing a good job. I know you can do this. Based on what I've heard, I know you can do this. You actually have the right information. Those are affirmations. And it's important, especially nowadays, for people to actually hear those, right? Even us, we are doing a good job, right? You are doing so well in helping the community. And that gives a boost, a confirmation on the receiving end that at least even with their doubts, with their hesitations, that somehow they're doing something correctly. Are you guys doing the ask, offer, ask method? This is really good for advocacy too, in stating your advocacy. Ask, offer, ask method is, how are you doing? Ask. I have information about COVID vaccines today. Offer. The last ask. Do you have time to discuss it? That's the ask, offer, ask method. Now, I want you to think of this method, and I want you to give me an example, live audience and online. How would you use the ask, offer, ask method? I gave you one example. How are you doing today? Ask. I do have information on the COVID vaccines. Offer. Last ask. Do you have some time today? I can discuss it with you. Do you find this method very respectful, right? It's not invasive, it's not authoritarian. Can you think of any examples for both our online and live, how you would do the ask, offer, ask method? Yes, Susan.
I mean, there's a picture of like a few white patients that are willing to learn about lifestyle practices of treating chronic illnesses. So I would ask, so what is your goal?
Yes.
Today, right? And I offer and say, would you like to hear about the lifestyle and education approach first before me already offered that. I know that I asked if they want to hear about it.
Yes. Most of us are actually doing this. We're just not simplifying it to fall within that ask, offer, ask method, right? So we are offering this most of the time, but we have to also be cognizant that this is what we are doing so we can actually have that outcome, that we know that this is what we wanted to do for our patients, right? So that's the ask, offer, ask method. Let me just check online to see if they have any questions right now. Example, you're in agony, where's the pain? Yes. Would you like something for the pain? That's the offer. And what would be the ask again? Okay. That's actually a great example, right? About treating patients with pain. What is your pain scale from 1 to 10? Okay, very good. And then, of course, we have to assess the readiness to learn. All right, now, the next technique or method that I want you to know is about science media literacy confidence. Okay, I'm not trying to rush. We have a little bit more of time left, like 20 minutes. So I want to be able to cover everything. This is the second thing that I want you to learn from me today. Do you know that 3 in 4 Americans overestimate their ability to distinguish legitimate news from false information? That means majority of us here in this room and in our online audience are not able to decipher what is correct information when we get that information about health. Why do you think so? Online chat, I want to see your participation. Why do you think we have difficulty sometimes discerning what is the correct example, what is the correct information from the false news, from the false information? Anyone? Okay, yes.
We make it simple. I mean, so if it's available out there, just to sit and watch the news, then that's it. You will believe it. But you know, go back to myself only. And evidence-based, I will search legitimate resources.
Yes.
Literatures and
Thank you.
that I would get the right information. So not just relying on that.
Yes, I hope our online audience heard that. We don't have time to actually clarify it, right? Yes, Tita Carmen, and then Kim next.
The polarization of the individual's political divisiveness.
Correct.
You know, that is important.
Perceptions.
And individual beliefs and all those things are playing having a play in what is the real news and what is fake news that we know as of today. Even now, we ourselves are confused on so many things.
Yes.
We don't know which one to believe.
Yes, confusion is so easy because we're getting it in so many ways and in different forms, right? How about you, Kim? What's your input?
It's sad to say that they have mastered connecting to individuals. They have mastered that, so they make the content very relatable, very in their level, and that's how they get to penetrate their thoughts and connect the current knowledge base with something that's.
Yes, so it is affected by our associations too, right? The people that we connect with, the people that we hang out with, where they're getting the information, how it's actually shared with us, right? So very good. That's a very good input. Thank you. And online, a lot of our audience have actually made some great insights here. And I want to read a few and share, you know, because majority believes in the wrong information. Going with the flow, correct. Going with the flow. Explosion of information everywhere, not from reliable sources, and some are personal information. There is a big trust in social media. Remember, let's go back to that word trust, right? How we have defined trust. And we are all guilty. I actually get a lot of hacks from TikTok, right? But that is my source of information nowadays. Why? Because it's so easy. In less than 5 seconds, I can learn something on how to boil an egg faster without having to turn on the stove. right? That is the hack that I've learned today. And it worked. It probably will kill me later on that day, but it worked. It cooked my egg without having to turn on the stove, right? So that's the source of information we are getting. And this is what I wanted to impart to everybody. Science literacy is about critical thinking. It is about analyzing where our information is coming from, especially with us as nurses, because we have that direct responsibility of providing the correct information that could save lives, right? So this is that statement that I want you to understand. Now, I'm going to ask you to be honest with me right now. What is your primary source of information? And I want you to be honest, no judgment here. Where do you get your information? Whether it's news, whether it's health information, where? Somebody says CNN. I haven't even watched CNN in a while. I'm being honest. Yes? Yes. No, I mean just major information. And you can say what kind of information? Online. Tell me where you actually get your source of information. How many more people are reading newspapers? Right? Holding a newspaper and reading it. How many? Oh, I have 2 here. Who mostly get it from their phone, social media, right? Oh my God, majority. It's easy. It's within your finger. Swipe left, swipe right, right? Google, MSNBC, Facebook, Instagram. Yes. Yes, gossip. Somebody said, mga marites. Yes. So now I have the whole audience here. So we get our source of information from varying sources, right? And we don't really have time to actually validate or do that. Now, this is a survey that was done in 2019 before COVID, and you can look at the numbers, the impressive numbers here. There's already 18% of those that were surveyed that were getting their information from social media. I'm not sure how it is now after the pandemic. Remember, the pandemic was a game changer. And I'd be curious what these numbers would be. Now, how can we improve our science literacy? Because, you know, we all need to improve our science literacy. We have to make sure that somehow our information is valid. So online community, please go ahead and share your suggestions how we can improve our science literacy. And how about here in our on our live audience, how can we actually improve our science literacy, especially us? You know, this is part of our practice as nurses.
You know, you can say reliable source, but then again, the next question is, what is?
Yes. What is reliable source? And what is reliable source? So I'm mixing now our interactions between online and live. What is a reliable source? I'm almost done. I have 10 minutes. Yes.
Reading or access to peer
Yes, definitely. Evidence-based, peer-reviewed journals, right? Recent studies. I have a few here that I have actually, outlined. First, the easiest one is to really ask, verify and consider your resources, compare your information, right? You're free to do that. Evaluate the legitimacy and validity of the information, be objective, manage your emotions and perspectives when you're reading it, because sometimes that clouds your ability to discuss or ability to impart. And of course, ask trusted experts. And like Dr. Remigio said, make sure you're getting it from valid resources like peer-reviewed, and of course, to think critically. The next thing I want you to learn, I know I'm fast tracking this because I only have now 10 minutes. I want to make sure that we're almost there. Neuromarketing. Have you heard of this term? You're probably doing this already and you don't know. I posted here the scientific definition of neuromarketing, but simply, it is content that is brain friendly. If you have posted on Facebook, Instagram, LinkedIn, and other apps, you are actually doing better in posting brain-friendly content, right? It's easy to read, it's appealing, it gets the hook, it gets the attention of people. You get the like, you get the views, you get the 1,000 reach, right? And this is very effective if you've mastered neuromarketing, if you are doing a lot of community outreach, patient education in clinics, like our activities with PACL, with DOH, right? So I wanna just do that. And if your goal is to be an effective content creator online, here are some contexts that you should consider. Make sure that your visual and text content elements are likely to be effectively engaging, right? And how does that work? Use appealing stories. You've heard of how effective stories are, especially when you share it. It becomes more relatable that way. When somebody actually says, oh, I'm glad you experienced that because I went through the same thing. It builds that connection. Remember those two things in the beginning? Advocacy and connection. You actually do those two things by just sharing your story. You make yourself relatable, right? Have it to be clear and concise. Use appropriate technology. You know, technology abounds now. You can actually do so many. And I am very thankful for the technology support that I'm getting today. I want to thank Aubrey. Insert the plug right here, right? And of course, Davey and Carmel, yes, for doing appropriate technology. These people have this expertise to actually tell me, Laarni, you cannot go ahead with this. It's not going to be effective. It's not going to be efficient. Use relatable resources, keep them engaged. Textual framing, yes. I am getting a note. Yes, I will. Okay, thank you. How about online? How are you feeling so far? Let me see. Evidence-based practice, yes. Going back, reliable, yes. And here's an example of neuromarketing that I want you to go through. And I'm going to give you like a sort of a workshop thing. First, I want you to read this 2 example. This is a text, right? So it's in Word. One example of neuromarketing. I want my audience, there we go. My audience online and live to visualize 2 things. And I want you to tell me which one is brain friendly and which one is not, right? One scenario is a picture of a needle on your arm with a caption, get your shot to prevent COVID. I want you to visualize this, right? Or a picture of a nurse with a thumbs up and a sticker, and it says, I got my vaccine, with a caption, the brave, the vaccinated. 2 minutes?
No,
Second, right? Why? Why is that brain friendly for you? Because of the thumbs up? It conveys a little bit more positivity, right? A needle in your arm is not positive. It's scary, especially for your public. So let's go back on that thought. You have to know your audience. You who are creating the content probably says, you know, a needle in the arm would be more moving, right? Because you're a nurse. But who is your audience? It's the public. Children, mothers, grandparents, elderly, whatever, right? A needle in your arm is not positive for those type of audience. Very good. Another thing to visualize between the 2, a child crying, being held by their mom at a doctor's office with a caption, save a life, get vaccinated, or a happy child smiling, interacting with a healthcare provider with a caption, healthy babies deserve the best love, let's keep them safe and get them vaccinated. What is more brain friendly? Online? Can you see? I'd be interested to hear what you think is more brain friendly. Number 2, yes. Why? Because there's a happy child. Who wants to see a crying baby, right? If you're a mom, you don't want to see a crying baby. So there you go. You lost that audience right off, right? If you're a grandmom, you don't want to see a crying baby. I'm single, I don't want to see a crying baby, right? But a happy child makes them think that this is really good for them. Okay, another example. This time will be more visual. I've made it easy for our audience to say which one is brain friendly and which one is not brain friendly. Why do you think the poster on your left It's not brain friendly. And we are guilty of this. I actually, when I was going through this material, I'm like, oh my God, I do this. I should stop doing it. Yes, Dr. Sagar.
It's too busy.
Very good.
There's too many things.
Correct. Whatever happened to concise? Whatever happened to direct to the point? Whatever happened to, what is the message we're trying to drive at? Yes, Dr. Mayo.
There's a lot of painful emotions.
Yes. Yes. There's somebody there having difficulty breathing, right? That lady with the asthma with the inhaler, right? While the brain-friendly content is more positive. It's showing that you are stronger after getting the vaccine. So it's all in the messaging, right? Okay, let's do one more. What do you think? What is the reason why one poster is unfriendly and the other poster is friendly? I also learned this. Oh, sorry. There you go. There. On this next slides, why do you think the poster on the left is unfriendly and the other one is friendly? Online chat, please go ahead and participate. Right? Yes, Dr. Sagar.
The second one is empowering.
Yes, it's empowering. The message is clear. But here's another thing too that, when I was going through material, we have to refrain from using strong colors. There's too much red on the poster on the left. And even if our goal as content creators is to actually make them catch the message, red is actually it has a different emotional response to some audience, right? So you have to take note of the colors that you use in doing posters. Okay. I'm going to skip this last one, but I just wanted to point out, I am very guilty of the brain unfriendly poster on the left. I do that a lot. QR code, price, everything, my sponsors, everything has to be in the poster. And it shouldn't be that way. The posters are just meant to get attention, to get them interested. So make sure that you edit how you do your posters. Okay, here are some more last minute driving things for neuromarketing. I want you to consider this. I think we're going to make the PowerPoint presentation available to everybody as well who have attended. And here are just some. These are actually great things for those who are aiming to be content creators online. I learned a lot about camera angles, shot length, color schemes, font size, production pacing and effects, copy content to engagement. I also want to acknowledge our online audience. If they have any questions, this would be a good time for you to place them on the chat. And of course, the last thing is brain-friendly content must reduce defensiveness. Remember, neutral information is good. We should not, evoke high or strong emotions that prevent them from learning from us, okay? So be careful with that. Now, I love food. Food is my love language, and I thought this was a perfect analogy of how you should present your content to your public. There's a bite size when you actually get snappy headlines, descriptive subject lines, quick content. This is very applicable if you're trying to reach people through Twitter, Instagram, and Facebook, and your LinkedIn accounts. And of course, there's the snack size meal, which are the key takeaways. Abstracts, which are the summaries, those will be good. Just the lesson to learn. And of course, the meal, the full articles, the case studies, and you can also link them if you need to. Let's apply everything together. I have a few more seconds. Okay, all right. Our goal today is to manage misinformation. And here are some of the things. And now we're going to play the three, right? Motivational interviewing, science media literacy, and neuromarketing. How do we take care of strong emotions? There we go. How do we take care of strong emotions? Because not everybody is going to agree with us, right? I'm sure a lot of you experienced that during the pandemic. And I'm sure a lot of you have experienced that in the hospitals. You're trying to give them information and they have a lot of strong feelings for it. This is where motivational interviewing will come very handy, right? And it is also important for you to acknowledge what they're feeling. I can see that you're upset. Would you like to talk about it? How are you feeling regarding this particular medication or this particular decision or treatment care? Right? So that's motivational interviewing. When you're trying to raise awareness, and this comes now, I think somebody had mentioned about associations, right? When you raise awareness on certain groups that are against certain health practices, we've encountered this. Vaccine was one of those topics, right? This is now where science media literacy will actually help. And then to counteract negative emotions and activate positive emotions, you can do a combination of any of the strategies that I just told you. The bottom line, we have the ability to inspire and influence. These are two strong words that actually change behavior, improve practice, better lifestyles, and enable our patients to make the right decisions. That is the goal here each time. And I hope that you have learned so much from me today. Here are some of the references. I want to thank you for waking up early in the morning to join me today, and I hope that the information I've imparted is actually very helpful. I do want to mention a special thank you and an acknowledgement for one of our members who cannot be here today, but have been an integral part in helping with this event. So we want to send love to Tita Leonie Maria Seda, who is actually right now in California, for even though she's going through something really, really personal today, that she has somehow pulled this together for us in time for a successful hybrid presentation, coordinating for the facilities here in VA. So Ate Leonie, if you are in the platform, we want to say thank you. We love you, and we can't wait to see you when you come back. We will entertain a few questions. Do we have time for a few questions from our audience online or feedback? 2 minutes. Any and our online, you can unmute yourselves and join us. I would love to hear your voices. Okay. And yes, I do want to disclose, we had some issues getting contact hours for this. Unfortunately, we didn't get it in time, but you will still get a certificate of attendance. We do require you to do a course evaluation. The link will be posted online, and it will also be sent to those that have registered officially for this. We are live streaming it on Facebook, and I think it will be repeated again. Thank you. Thank you so much for the feedback. Any questions? Anyone? All right, great. I think we did a great thing. Yeah. Thank you, everyone.
Good morning again. My name is Janet Kwaikong. I'm the president for the Philippine Nurse Association of New York. I would just like to commend a big applause to our resource speaker, our President-elect, Ms. Laarni Florencio, 2022-24, for doing a great job with this hybrid. And thank you all for sharing us your morning. And I would like to thank our PNAA and PNAF sponsors for this event today. And thank you, and hope you learned so much. But before we go, I would like to present this certificate of appreciation to Ms. Laarni Florencio. MSN RNCNL in honor of her outstanding commitment to professional nursing excellence in her valuable contribution as a resource speaker during the PNA 2023 Summer Hybrid Conference titled Building Confidence as Trusted Messenger of Health Information, giving this day, 19 of August 2023 at the VA New York Harbor Healthcare System, New York, New York, 110. Signed, Janet Koikong, President PNA New York 2022-24, and Laura Garcia, our Chair of Education, Chair Committee. Laarni.
Thank you so much, PNA New York. Thank you. It was my pleasure. Thank you. I hope people appreciate it. We were having like 3 screens on stage to manage the hybrid. So thank you so much. Oh, go by this one. Thank you.
That ends our presentation for today. And thank you so much for all who tuned in for both in Facebook and our hybrid conference this morning. And hope you have a great Saturday. And I know I have some audience in the Philippines. And to, I think some of the states have other chapters. Thank you so much for tuning in. Mabuhay ang PNA.
Thank you guys. Thank you.